Good afternoon, guys. This is Thelma from Plastic Surgery at Palm Beach. Today we're going to be talking about pre-ops and what to expect if you're to come in after a consultation for a pre-op visit. Pre-op visit is technically after your consultation. You come in and you speak to one of the nurses. Good afternoon, guys. This is Thelma from Plastic Surgery at Palm Beach. Today we're going to be talking about pre-ops and what to expect if you're to come in after a consultation for a pre-op visit. Pre-op visit is technically after your consultation. You come in and you speak to one of the nurses. The folder, there is the packet that we go over, and there's things that, little recommendations that you can do after surgery. Keep in mind we do multiple surgeries, so everything is completely different. The only thing that is the same, I would say, would be like what not to take over-the-counter medications. A lot of people are not familiar with it. So we do in the packet give patients a list of what not to take 2 weeks. In the packet, you also go home with what to expect prior to surgery, after surgery, and also a supply list of what the patient needs to buy depending on the surgery that they do get. For myself, just to keep notes, I do a checkout list. I also print out what's called a medical clearance form. Normally, our surgical coordinators do fax over the medical clearance form to the patient's primary care doctor. And then sometimes if the primary care doctor did not get it, at least the patient has it. So whenever they schedule their appointment, they're able to get that done. What the medical clearance consists of is sometimes labs, EKG, other testing to clear them for surgery. Not every procedure requires one. It depends on the patient's age and obviously their medical history, their surgical history, and so forth. They do have at our visit, I do a checklist for myself just so I can follow up on the medical clearances for patients, and also get all the information like the pharmacy number, because we do call in medications after surgeries for patients. And then I do make sure that the patient leaves with a card with their post-op appointments. Normally, a lot of doctors here like their patients to come in one day after surgery. If it's on a Friday, we do see our patients on a Saturday morning just to check up on them and to make sure that they're doing well. And if not, then they come back on Monday, depending on what doctor's seen who. We do make sure that our patients are aware that our services are 24 hours. We do have an on-call service, and if they have any questions, they do call and speak to one of the on-call doctors. If it's within time that we're open, they can speak to one of the nurses, and obviously if it's out of our scope of practice, they can come in and see a doctor.